Good evening. I was trying to figure out what time it was. There no windows here. Good evening. And I want to thank Tom for that introduction, and only my mother could love. And the one correction I'll make is I only do things on the south side of Chicago. so and I don't want to. I'm trying to think how to say diss my West Side brethren, but I'm a South Sider, as I like to say, by birth and by choice. I could live anywhere in the city, but I choose to live where I live. It's great. I see a couple of old friends in the audience. I just want to acknowledge Dr. Monica Lipson, who I've known since she was she was a little bit bigger than that. We were in high school at the same time, and her husband, Drew Campbell, and also a good friend, Ben Vreem, who extended the invitation to be here today. So I want to thank you all for one, inviting me, Ben, and Monica and Drew for being who you are. I am quite a privileged individual, and I recognize that. Earlier this week, I watched the Chicago Bulls play the Miami Heat, sitting courtside with our new mayor, Rahm Emanuel. I was privileged to be at Oprah Winfrey's last show, at the United Center. So a lot of estrogen in there, but I hung in there. I wasn't quite sure how I was going to make it. Yesterday saw the White Sox at their U.S. Cellular Field get a win, but I have to tell you the capstone is being here at the University of Michigan. So I've had a big week, and so want to again thank you for the invitation. And as I talk, I want to give a caveat because I'm a quasi-academic. I don't consider myself a real academic, and one of the things my bosses have always thought is that I'll say almost anything. So I have to give give that background because I'm about to say a lot of things. And one of the things that has historically been true about the University of Chicago and its relationship with its neighborhood is that there's always been a significant amount of distrust. In fact, and that's not unique to a lot of academic institutions in the communities in which they sit. In fact, when I first started at the University of Chicago in 2007, I used to ask crowds like this, how many of you all distrust the University of Chicago? And I would have my hand raised. And my boss would tell me, you can't do that. And I said, if I'm keeping it real, that's what the deal is. And in fact, Monica, we actually did a research fellowship at the University of Chicago together. And if I told her that I would come back to the University of Chicago to actually work, she would have been as surprised as I am today. But there's a woman, you all probably have heard of, named Michelle Obama. She can be persuasive when she puts her mind to something, and she twisted my arm to come back and really reach back into why I became a physician. And if you were to pull up my application, it really said that I wanted to become a doctor so I could improve the south side of Chicago. And now, after having been, as Tom mentioned, I've worked at Cook County Hospital and done a lot of work with African American men's health, being on the community side of medicine, across from the big academic center. I've been at the state running and regulating the state health system. I've come full circle back to an academic institution that, frankly, I've felt needed to get pushed to do some of the right things. And I have to say, I've been proud that the institution itself has responded. But institutions are institutions for a reason, right? they are resilient, and that's why we must be diligent as we move forward. So I just again want to say that just give you that context that when we talk about going working with community in an instance where we've historically been a bad partner, it's no small notion to try and advance research, particularly when you throw in the distress of research in and of itself, separate from our university. In fact, a lot of what I did early on was go out and meet with community groups and with the political leadership, and you would hear Tuskegee come up over and over again. And I'm proud to say, fast forward, 3 years after I started that work, And now the political leadership and the community groups are saying, we're not working fast enough. They're not afraid of research in the way that they were just 3 years ago. And in fact, I think we have the substrate for moving the needle as it relates to health on the south side of Chicago. Now, what this has meant is we've actually, before I started, I ended up changing my own slides, and I just want to call attention to some of the funding sources we've had, because one central thing that is clear to me at least, and I'm sure it's clear to you all, is that you need resources to do this work, and plenty of them. You need resources to support the community to do a lot of the things that they need to do, and there needs to be some balance in how resources are shared. And we've been fortunate enough that we've gotten funding for this thing called the Urban Health Initiative from NIH. When I came, I had a pot of money that I've been able to use for the UHI. We've actually worked with corporate entities also, like PepsiCo, which is a new thing for community to get engaged in a discussion about should we take their money. And in fact, I found the community was more open to us taking the money than some of the people on our campus. We ended up going through a community process where PepsiCo had to show up at Salem Baptist Church, one of the largest mega churches on the south side of Chicago, 18,000 members, and had to address the community and talk about what they would do if we took their money and how they would help improve things on the south side. They acknowledged that, yes, we know you produce all of the flaming red hot chips and the bad drinks, but we need your help in terms of improving health. And certainly have had a lot of support from individual philanthropists. What we've had to do with this thing called the Urban Health Initiative is turn the typical academic paradigm on its head. And I show you this picture just to tell you about a project we have that's called the Comer Food Project. And the young lady in the center of this picture is a minister. And she noticed when she was going about her rounds that there were parents that were in the room at our children's hospital who were hungry and needed food. And so she mentioned that to one of my collaborators, who then talked to Monica Vela, the physician that's here on the right-hand side, who brought in Dorian Miller, who's a physician on the bottom, and we began to think about, okay, how do we address this need of people being hungry in our hospital while their children are being cared for? And this was discussed with our medical students, who stepped forward and decided that they wanted to help craft a solution. So the need came first and became an acknowledgement. We then worked together with the Chicago Food Depository, and since February 2010, there's been 600 bags of food distributed, 4,000 pounds of food purchased, and now we're starting to do research on this project and looking at a needs assessment. How might we improve the quantity and quality of food served, and also adding personal care items, I should say. And this project is now being replicated in hospitals in Chicago. So again, saw the need, worked collaboratively with individuals who were in need, and now there's a program that's meeting the need. And so this is and we're doing research on it, but it came at the back end of the whole process. And so, we have what I would call a hairy, audacious goal for the South Side of Chicago and the Urban Health Initiative. That is that we would have a model of excellent urban health by 2025. And, and when I talk to our faculty, they're energized by this sort of goal. I think my dean told me he wouldn't be here, so he will let me let me come up with whatever I wanted to, because he wouldn't be here in 2025. This has given us something to organize around, and I think it's some would say not attainable. I actually beg to differ, and I'm an evangelist that we're gonna get this goal and do it right. Our mission is to create actionable knowledge that people can use to produce and sustain excellent health and vitality, both on the South Side and beyond. And this takes place in what we call systems, our delivery science, Also basic science, which is something called the Southside Health and Vitality Studies, and lastly, translational science, which one of the things that I started upon coming was the Center for Community Health and Vitality. In terms of the system side of things, we built on the work of Michelle Obama, who had created a program of 18 federally qualified health centers that would be the medical home for the 40% of our patients who come in the emergency room and don't have a regular doctor. We've since grown that, there's now 35 federally qualified health centers, and also we've brought in hospitals. So on the south side of Chicago, we have all the major health players sitting around one table thinking about quality. We're thinking about, how do we meet the subspecialty service need? How do we connect to one another with electronic health records? And that's about, again, the health systems and a delivery science. The basic science, the Southside Health and Vitality Study, is actually directed by, I think, a grad of University of Michigan, Dr. Stacy Lindow. And this is, all about trying to have the most well-characterized community in the country and having data at a granular level that we can then use through our Center for Community Health and Vitality to develop new programs in conjunction with community and then evaluate if these approaches work. This is, we talk about system, service, and science as our paradigm for how we will get to that goal by 2025. And there is a couple folks who are at Northwestern, J.P. Kreitzman and John McKnight, who have something called an asset-based community development model. And we modified the model, again, in conversation with our community. And the thing that, as you can see around the outside of the model, community engagement and relationship building is something that's iterative and continuous and has to happen at all phases. And this is a multi-stepped process which at the end needs to inform action. So again, this gets us away from this idea that you do science for the sake of science, but rather you do science to actually do something with the science. Again, actionable knowledge. And so the first step you undertake is identifying community priorities, and we're in the midst of doing that with our community, and I'll share some of that with you. We have worked to identify assets in the community, to leverage those assets, and then do our research, and lastly, generate new knowledge that can inform action. And so this is, again, is an iterative model, and importantly, unlike how things usually happen when people think about the South Side in Chicago, it doesn't approach the South Side as having deficits, but rather having assets. So there's something there. There's something there that can be built on. And I just want to share with you a quote that Michelle Obama spoke at something called Greater DC Cares at an event that speaks to this approach, which is one that she introduced to us before she left to go to DC. She said, "We can't do well serving these communities if we believe that we, the givers, are the only ones that are half full and that everybody we're serving is half empty. There are assets and gifts out there in communities, and our job as good servants and good leaders is not only just being humble, but it's having the ability to recognize those gifts in others and help them put those gifts into actions. Communities are filled with assets that we need to better recognize and mobilize if we're really going to make a difference." And so she said this in June of '09, but it really is the sort of spirit that animates the work that we're doing.